Before we begin, this story involves medical experimentation on vulnerable people, racial injustice, and institutional deception that lasted decades. If that's something you need to step away from, we understand. Take care of yourself first. This episode's narration is AI-generated. The research, writing, and editorial decisions behind every story are made with care for accuracy and respect for those involved. In 1947, a sharecropper in Macon County, Alabama, walks into a cinder block clinic for his annual checkup. A nurse, the men call her Miss Rivers, smiles and hands him a small white pill. He swallows it without water. He's been swallowing these pills for 15 years, and they've never made the aching in his joints go away. He doesn't know why. He also doesn't know that the pill is made of aspirin and sugar, that 300 miles north in a government office, a doctor has just signed a memo ensuring that the actual cure for what's killing him will never reach this clinic. Every story in here actually happened. That's the part that should scare you. This is the Unlit Room. New stories every week. Today, how the United States government watched men die of a curable disease for 40 years and called it science. Macon County, Alabama, the heart of the Black Belt, named for its dark, fertile soil, though the name would take on another meaning. In 1932, this is one of the poorest counties in America. Most of the men here are sharecroppers. They work land they don't own, live in houses without plumbing, and most have never seen a doctor. The U.S. Public Health Service arrives in Macon County with an offer that sounds too good to question. Free medical exams, free meals on clinic days, and for families scraping by on sharecropper wages, the detail that closes the deal, burial insurance. Enough to cover a proper funeral, something most families here can't afford. 600 men sign up. They don't know it, but they've just enrolled in what will become the longest non-therapeutic experiment in American medical history. 399 of them have latent syphilis. 201 don't. The PHS wants to study what syphilis does to the human body when it's left completely untreated. The men in the first group, the ones who are sick, are told they have bad blood. That's it, bad blood. A phrase so vague it could mean anything, and in rural Alabama in the 1930s it means almost nothing. Anemia, fatigue, general poor health. The men accept the diagnosis the way they accept most things handed down by white authority, without the power to question it. The study is supposed to last 6 months. The phrase bad blood was already common in the rural South, a catch-all for feeling poorly, for not having the energy to work a full day. By choosing it as their diagnosis, the researchers ensured the men would never understand what was actually wrong with them. Micro cliffhanger 1. But the 6-month study doesn't end in 6 months. It doesn't end in 6 years. And the reason it keeps going has nothing to do with science. The men believe they're being treated. They come to the clinic regularly. They see a nurse, Eunice Rivers, a black public health nurse from the area, the only consistent face they'll know for the duration of the study. She drives them to appointments. She brings them aspirin. She earns their trust over years and decades, and she does it because she believes, or has been told to believe, that the study is helping her community. What the men receive at the clinic looks like medicine, but isn't. Placebos, aspirin, vitamins. Nothing that touches syphilis. And then there are the spinal taps. The researchers need samples of cerebrospinal fluid to track how the disease is attacking the nervous system. A lumbar puncture is painful, a long needle inserted into the lower spine. The men are told this procedure is a special free treatment. They line up for it. They endure the pain because Miss Rivers told them it would help. It helps only the researchers who get their data and write their papers. Eunice Rivers stayed with the study for its entire 30-year run. After the exposure, she said she believed she was helping the men access health care they would never otherwise have received. Her role would become one of the study's most debated legacies. The trusted intermediary, exploited by the same system that exploited the men she served. Micro cliffhanger 2. Everything up to this point could, in the moral logic of the era, be explained away. The men were poor. Treatment wasn't available. The data was valuable. Then, in 1947, everything changed, and the study kept going anyway. Penicillin. By 1947, it's widely available. It cures syphilis. It is cheap, effective, and the standard of care across the country. In any functioning system, this is where the study ends. The men get treated, the data collection stops, everyone goes home. That is not what happens. The researchers decide that the arrival of a cure makes their data more valuable, not less. They now have the chance to study the full, uninterrupted progression of untreated syphilis in a population, something that will never again be ethically possible. They keep going. When World War II draft boards identify some of the study participants as syphilitic and order them treated before military service, the PHS writes letters. They contact the local draft board. They pull strings. The men are exempted from the draft, not to protect them, but to protect the study. The government intervenes to ensure its own citizens do not receive a cure that exists, that works, and that costs almost nothing. Micro cliffhanger 3. And here's what makes it worse. The men don't know any of this. Neither do their wives. The study was supposed to last 6 months. It runs for 40 years, under the supervision of multiple PHS directors, none of whom stop it. The institutional justification evolves like a living thing. In the beginning, these men are too poor to afford treatment anyway. By the 1950s, the data is too valuable to abandon now. By the 1960s, we've been doing this so long that stopping would raise questions about why we started. 40 years. That's not a study, that's a policy. By 1972, when a PHS researcher named Peter Buxton leaks the study to the Associated Press, the math is devastating. 28 men dead directly from syphilis, 100 dead from related complications, 40 wives infected, women who were never part of the study, never consented to anything, and never knew their husbands were carrying an untreated disease. 19 children born with congenital syphilis, babies who entered the world already damaged by a decision made in a government office before they were conceived. The men were never told they had syphilis. Their wives were never told. Their children, the 19 born with it, were never told. The United States government kept the secret for 4 decades. The only reason it ended is that one man couldn't live with it anymore and called a reporter. The Tuskegee study didn't just end in 1972. Its exposure led directly to the Belmont Report in 1979, the foundational document for modern research ethics. The rules that protect you today when you sign a consent form exist because of what happened in Macon County. It took 25 more years for an apology. In 1997, President Clinton stood before the surviving participants, 8 men, all elderly, and said, "What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry." 8 men, out of 600. That's who was left to hear it. The damage from Tuskegee didn't end with the apology. It seeded a mistrust of medical institutions in black communities that persists to this day. A mistrust that is not irrational, not unfounded, and not a failure of education. It is a rational response to a documented betrayal. When public health officials wonder why vaccination rates are lower in certain communities, or why clinical trial enrollment doesn't reflect the population, the answer isn't complicated. It's a county in Alabama, a nurse they called Miss Rivers, and a government that watched men die rather than give them a pill that cost pennies. Some wounds heal, some become the architecture of the building. More stories like this every week. Subscribe if you want the next one to find you. Follow the Unlit Room wherever you listen. Tell a friend who can't sleep. Full story on the main channel. Follow if you're wide awake. That was the Unlit Room. See you in the dark.